There's a financial penalty that kicks in at age 65 that most Americans have never even heard of, and another deadline that most people don't even know about. Miss one deadline, just one, and you could pay hundreds of extra dollars per month, or even have your insurance denied. In the next few minutes, I'm going to show you exactly how Medicare works, and I'm going to explain these two penalties to you so that you don't get hit with either one of them. I'm Daniel Perryman. I was a hospital CEO for 20 years, and I oversaw billing and benefits for thousands of patients. Here's what almost nobody explains clearly. Medicare has four parts. Think of it like a puzzle. So there's Part A, which is basically hospital coverage. And what this will cover is hospital stays, inpatient care. Think of this as covering the building, surgery, your room, nursing facilities. And this is free for most people if you or your spouse have worked and paid Medicare taxes for at least 10 years. The next is Part B. Part B covers doctor's visits, outpatient care, lab work, and preventative care. This part is not free. In 2026, it is now $202.90 a month. And this is the part that really trips people up, and I'm going to talk about that in a minute. Part C is Medicare Advantage. And this is private insurers who bundle A and B together and often add dental and vision. And more on this in a moment because I want to explain the difference, because this is very important and there's a deadline that you have to meet. And Part D is prescription drugs. This is a separate plan, a separate cost, and it covers most medications. So just remember that there's four parts of Medicare. So Part B, here's the rule that nobody tells you about before it's too late. So if you don't sign up for Part B at age 65 and you don't have active coverage through an employer, you get hit with a late enrollment penalty. And this is 10% is added to your premium for every full year you were eligible but didn't sign up. And it stays there forever. So for example, if you miss 2 years, that's a 20% penalty on top of the $202.90. So roughly $40 extra every month for the rest of your life. Over 20 years, this could cost $10,000 for a mistake that most people don't even know that they're making. And here's the trap that catches a lot of people as well. They think that COBRA insurance counts as employer coverage, and it doesn't. So COBRA doesn't protect you from this penalty. Only active employer coverage does. And the clock starts the day that real coverage ends, not when COBRA runs out. And you have 3 months prior to your 65th birthday month, plus your birthday month, plus 3 months after. So the window is pretty tight on this, and you definitely don't want to miss this and get a lifetime penalty. Before I get into the biggest decision you'll face in Medicare, and that most people get wrong, if this is already making sense and you want more of this, hit the subscribe button. I put out clear, calm guidance on Medicare, Social Security, scams, AI, everything that affects our age group. So let's talk about Medicare Advantage versus the Medicare Supplement Medigap. Now I consider this one of the biggest decisions that you're going to have to make with Medicare. And both paths can be somewhat confusing, and choosing the wrong one can actually cost you quite a bit of money. So I'm just going to go through them real quickly so that you understand the difference. So Medicare Advantage, this replaces your original Medicare, and many plans are $0 per month beyond the Part B premium, which was $202.90. So the advantages here are, it's usually $0 per month. It bundles dental, vision, and prescriptions. There's lower upfront costs. And it's a better option if you're generally healthy. But here's where you need to be careful. You're going to be inside of a network, so your doctor choices are going to be limited. You may need to get referrals for specialists. And copays and deductibles can change yearly. In 2026, the out-of-pocket maximum is up to $9,250. So if you get seriously ill, these costs can definitely add up. And then on the other hand is Medicare Supplement, which we refer to as Medigap. This actually works alongside Medicare. And right now a popular plan is Plan G. It's about $150 to $200 per month. and the deductible is only $283 per year. So the advantage is you can choose any doctor in the U.S. who takes Medicare. There's no networks, no referrals needed. There's predictable costs, so there's no surprise bills. And then Plan G covers nearly everything that's approved. The trade-off is you have a higher monthly premium, so Advantage it might be $0, this might be $200 per month. Prescription need a separate Part D plan, and then dental and vision are not included. So Medicare Advantage, there's lower cost up front, but there's more restrictions and variable costs. And the Medicare Supplement, Medigap, is a higher monthly cost, but there's more freedom and predictability. So this is critical. This is a deadline a lot of people don't know. So you have a 6-month Medigap enrollment window. When you turn 65 and enroll in Part B, insurers cannot deny Medigap or Medicare Supplement insurance or charge more due to health conditions. However, if you miss this window, most states can either reject you based on medical history or increase your rates dramatically. So if you miss this window, the window never comes back. So this is something that you need to pay attention to, especially if you have pre-existing medical conditions. So remember, sign up for Part B at 65 unless you have active employer coverage, and remember, COBRA does not count. And if Medigap interests you at all, protect that 6-month enrollment window. It's the only time that you're guaranteed the right to buy it. Subscribe for clear guidance on Medicare and Social Security. Share this with somebody turning 65. One video can save them thousands of dollars.